So let's talk about delayed cord clamping. So this is becoming more of a common practice, and there's a lot of research behind why this is a good practice. But let me explain what it is, the benefits, but also why hospitals are not so keen for you to do it. So delayed cord clamping, even if it is for 30 minutes or until the cord goes completely white, allows for all the blood from the placenta that is needed fills to the baby, and the baby is full of their own blood. So this means they have full capacity of their blood, which is full of all the nutrition, antibodies, protection, everything the baby needs is inside the baby and not still in the cord. So it's a case of waiting for the cord to turn white so that this can prevent babies from getting anemia or illness pretty early on in their life. So the reason why hospitals are skeptical a little bit about this is because you might know already that they often give you a vitamin K injection to your baby when they are born. And this is because it's to prevent a bleed on the brain. So it is in fact clotting the blood, so the blood is not thin where it can pour out into the brain and obviously lead to brain damage. So the vitamin K is there to clot the blood, but by doing this, obviously if there's a lot of blood in the system, there's more blood to clot, which can then lead to jaundice, which is obviously another common illness that happens in babies. So this is why hospitals have to come with the balance of the two. So while they give the vitamin K to clot the blood, they also then decide that the baby is not to maybe have the full blood, because then it's that balance between the two, which is a very difficult decision to make. But ultimately, as the parent, you have the choice as to whether you see the benefit as being having the baby having the full blood that is their blood in their body, or even if with the vitamin K injection you can actually refuse the vitamin K injection, but there's obviously a small risk, like I say, of baby's brain having a hemorrhage, which is obviously what hospitals are worried about. So it's a balance of risk for the parents to decide what is best for them. But delayed cord clamping, or there's another version called lotus birth, which is where there's no cord clamping at all. They wait until the placenta detaches itself from the baby, usually around 5 to 7 days, and they protect the placenta in the meantime in like a safe bag to keep the placenta protected and obviously away from infection. And that is another common thing, which is called a lotus birth. So that is where the placenta is not moved at all, and that is on the rise in popularity too.